Normal body temperature in a healthy adult oral is option A 35 degrees Celsius, option B 36 degrees Celsius, option C 37 degrees Celsius, option D 38 degrees Celsius. The correct answer is option C 37 degrees Celsius. The average normal oral temperature is 37 degrees Celsius, that is 98.6 degree Fahrenheit, though it can vary slightly between individuals. The most accurate site to measure core body temperature is option A oral, option B axillary, option C rectal, option D tympanic. The correct answer is option C rectal. Rectal temperature closely reflects core temperature and is most accurate, especially in critical care. The most accurate site to measure core body temperature is option C rectal. The normal range of oral temperature is option A 35 to 30 degrees Celsius, option B 36 to 37 degrees Celsius, option C 36.5 to 37.5 degrees Celsius, option D 37.5 to 38.5 degrees Celsius. The correct answer is option C 36.5 to 37.5 degrees Celsius. The lowest body temperature in a day usually occurs. Option A early morning, option B afternoon, option C evening, option D midnight. The correct answer is option A early morning. Body temperature for A circadian rhythm lowest in the early morning and highest in late afternoon or evening. Lowest body temperature in a day usually occurs. The device used to measure body temperature is option A barometer, option B thermometer, option C hygrometer, option D sphygmomanometer. The correct answer is option B thermometer. Thermometers measure body temperature using mercury, digital or infrared methods. The device used to measure body temperature is option B thermometer. Axillary temperature is usually lower than oral by option A 0.1 degree Celsius, option B 0.5 degree Celsius, option C 1 degree Celsius, option D 1.5 degree Celsius. The correct answer is option B 0.5 degree Celsius. Axillary readings are about 0.5 degree Celsius lower than oral due to peripheral cooling. Rectal temperature is usually higher than orally by option A 0.2 degree Celsius, option B 0.3 degree Celsius, option C 0.5 degree Celsius, option D 1 degree Celsius. The correct answer is option C 0.5 degree Celsius. The rectal site reflects core temperature which is slightly higher than oral. The rectal site tympanic thermometer measures temperature through. Tympanic thermometer measures temperature through option A mouth, option B ear canal, option C axilla, option D forehead. The correct answer is option B ear canal. Tympanic thermometers detect infrared heat from the eardrum. The medical term for fever is option A hypothermia, option B pyrexia, option C hypothermia, option D febrile seizure. The correct answer is option B pyrexia. Pyrexia refers to elevated body temperature due to infection or illness. Medical term for fever is option B pyrexia. Temperature below 35 degrees Celsius is called option A hyperpyrexia, option B hypothermia, option C pyrexia, option D subfebrile. The correct answer is option B hypothermia. Body temperature below 35 degrees Celsius, that is 95 degrees Fahrenheit, indicates hypothermia. Temperature below 35 degrees Celsius is called hypothermia. Temperature above 40 degrees Celsius is termed as option A hyperpyrexia, option B hyperthermia, option C fever, option D hypothermia. The correct answer is option A hyperpyrexia. Hyperpyrexia is an extreme form of fever above 40 degrees Celsius, often due to severe infection or heat stroke. Temperature above 40 degrees Celsius. The main thermoregulatory center in the body is located in option A cerebellum, option B hypothalamus, option C medulla oblongata, option D pituitary gland. The correct answer is option B hypothalamus. The hypothalamus maintains core temperature through heat gain and loss mechanism. The main thermoregulatory center in the body is located in option B hypothalamus. Which thermometer gives the fastest reading? Option A mercury thermometer, option B digital, option C tympanic infrared, option D glass thermometer. The correct answer is option C tympanic infrared. Infrared tympanic thermometers give rapid readings within seconds. Infrared tympanic thermometers gives rapid readings. The site least accurate for temperature measurement is the least site accurate for temperature measurement, option A oral, option B axillary, option C rectal, option D tympanic. The correct answer is option B axillary. Axillary temperature is less accurate because of air exposure and sweat interference. In fever, hypothalamic set point is option A decreased, option B increased, option C unchanged, option D lost completely. The correct answer is option B increased. Pyrogens raise the hypothalamic set point, causing shivering and increased temperature. In fever, hypothalamic set point is increased. Hypothermia differs from fever by option A caused by infection, option B controlled by hypothalamus, option C no change in hypothalamic set point, option D response to pyrogens. The correct answer is option C no change in hypothalamic set point. Hyperthermia, body temperature rises uncontrollably without a hypothalamic adjustment. Hypothermia differs from fever by which of the following can cause hypothermia? Option A fever, option B sepsis, option C cold exposure, option D exercise. The correct answer is option C cold exposure. Which of the following can cause hypothermia? Prolonged exposure to cold reduces core temperature below normal. Hypothermia can reduce by cold exposure. The temperature recorded in mouth is known as option A oral temperature, option B core temperature, option C peripheral temperature, option D axillary temperature. Correct answer is option A oral temperature. Oral temperature is a convenient estimate of internal body heat. Oral temperature is a convenient estimate of internal body heat. The body temperature is lowest during option A sleep, option B eating, option C exercise, option D stress. The correct answer is option A sleep. Metabolic activity decreases during sleep, lowering body temperature. The body temperature is lowest during sleep. Fever due to malaria shows which type of pattern? Option A continuous, option B remittent, option C intermittent, option D relapsing. The correct answer is option C intermittent. Malaria fever spikes periodically depend on the species of Plasmodium. Fever due to malaria shows which type of pattern? The correct answer is option C intermittent. Fever with normal morning temperature and high evening temperature is called. Fever with normal morning temperature and high evening temperature is called. The correct answer is option C continuous fever. In continuous fever, temperature remains elevated throughout the day with a minimal fluctuation that is less than 1 degree Celsius. Fever with fluctuations greater than 1 degree Celsius but without reaching normal is called. Option A intermittent fever, option B remittent fever, option C stepladder fever, option D relapsing fever. The correct answer is option B remittent fever. Seen in infective endocarditis, temperature fluctuates daily but never returns to normal. Fever in which temperature returns to normal between spikes is option A intermittent fever, option B continuous fever, option C relapsing fever, option D septic fever. The correct answer is option intermittent fever. Intermittent fever is a typical in malaria. The patient experiences febrile periods. And stepladder type fever is characteristic of option A typhoid fever, option B malaria, option C influenza, option D tuberculosis. The correct answer is option A typhoid fever. In typhoid, temperature rises gradually in a stepladder pattern over days. Stepladder type of fever is a characteristic of option A typhoid fever. Relapsing fever is caused by option A salmonella, option B Borrelia recurrentis, option C plasmodium, option D brucella. The correct answer is option B Borrelia recurrentis. This spirochete causes fever that relapses after febrile intervals. Relapsing fever is caused by which of the following is not a febrile condition? Option A malaria, option B pneumonia, option C hypothermia, option D typhoid. The correct answer is option C hypothermia. Hypothermia refers to abnormally low body temperature, not fever. Hypothermia refers to abnormal low body temperature, not fever. Fever above 41 degrees Celsius is considered option A mild, option B moderate, option C high, option D hyperpyrexia. The correct answer is option D hyperpyrexia. Extremely high fever that is greater than or approximately equal to 41 degrees Celsius can cause brain damage if not treated immediately. Which of the following instrument is used for measuring body temperature continuously? Option A clinical thermometer, option B laboratory thermometer, option C thermistor probe, option D digital thermometer. The correct answer is option C. Thermistor probes are used for continuous monitoring, especially in ICU settings. Thermistor probe. Thermistor probe are used continuously in ICU settings. The body temperature in newborn is usually option A higher than adults, option B lower than adults, option C same as adults, option D unpredictable. The correct answer is option A higher than adults. Newborn have higher metabolic rates and less temperature control, leading to slightly higher readings. The body temperature in newborn is usually higher than adults. The temperature of 100.4 degree Fahrenheit indicates option A normal, option B low grade fever, option C high grade fever, option D hypothermia. The correct answer is option B low grade fever. Fever between 99.5 to 100.9 degree Fahrenheit is considered low grade fever. Temperature of 100. Which hormone influences heat production in the body? Option A insulin, option B thyroxine, option C estrogen, option D cortisol. The correct answer is option B thyroxine. Thyroid hormones increase metabolism, thereby increasing heat production. Thyroxine hormone influences heat production in the body. Shivering increases body temperature by option A decreasing metabolism, option B increasing muscle activity, option C causing vasodilation, option D reducing heat loss. The correct answer is option B increasing muscle activity. Shivering generates heat through rapid involuntary muscle contractions. Shivering increases body temperature by increasing muscle activity. Sweating helps to increase body temperature. Option B. Conserve energy. Option C. Cool the body. Option D. Prevent heat stroke. The correct answer is option C. Cool the body. Evaporation of sweat dissipates body heat to maintain temperature. Sweating helps to cool the body. A rectal thermometer has option A long narrow bulb, option B short rounded bulb, option C flat bulb, option D electronic sensor. The correct answer is option B short rounded bulb. The short bulb prevents injury to rectal mucosa during insertion. A rectal thermometer has short rounded bulb. Auxiliary temperature should be kept for how long using mercury thermometer? Option A 30 seconds, option B 1 minute, option C 3 to 5 minutes, option D 10 minutes. The correct answer is option C 3 to 5 minutes. It takes longer for the mercury to equilibrate with auxiliary temperature. Auxiliary temperature should be kept for 3 to 5 minutes. Oral temperature should not be taken immediately after. Option A drinking water, option B eating food, option C smoking or drinking hot or cold fluids, option D sleeping. The correct answer is option C smoking or drinking hot or cold fluids. These activities alter mouth temperature, leading to inaccurate result. Oral temperature, the most reliable method of temperature measurement in unconscious patient. Option A oral, option B axillary, option C rectal, option D tympanic. The correct answer is option C rectal. The rectal route is accurate and independent of patient cooperation. The most reliable method of temperature measurement in unconscious patient is option C rectal method. Body temperature below 35 degrees Celsius is dangerous because option A metabolic rate increases, option B enzyme activity decreases, option C sweating increases, option D circulation speeds up. The correct answer is option B enzyme activity decreases. Low temperature slows enzyme and organ function, potential leading to death. Persistent fever lasting more than 3 weeks with no known cause is called option A chronic fever, option B fever of unknown origin, option C relapsing fever, option D subfebrile condition. The correct answer is option B fever of unknown origin. It requires evaluation when the cause of prolonged fever remains unexplained after routine test. Which thermometer is safest for children? Option A mercury in glass, option B digital thermometer, option C rectal thermometer, option D clinical mercury thermometer. The correct answer is option B digital thermometer. Digital thermometers are quick, safe and mercury free. Digital thermometer are quick, safe and mercury free. Heat stroke is a condition of option A high body temperature with sweating, option B high body temperature without sweating, option C low body temperature, option D fever due to infection. The correct answer is option B. In heat stroke, thermoregulation fails and sweating stop causing rapid temperature rise. In heat stroke, thermoregulation fails, sweating stop causing rapid temperature rise. The main function of sweat glands in thermo temperature regulation is option A secretion of waste, option B cooling through evaporation, option C excreting electrolytes, option D conserving heat. The correct answer is option B cooling through evaporation. Evaporation of sweat lowers skin temperature, aiding heat loss. The main function of sweat glands in temperature regulation is cooling through evaporation. Which of the following is a symptom of hypothermia? Option A flushed skin, option B rapid pulse, option C shivering and pale skin, option D sweating. The correct answer is option C shivering and pale skin. The body attempts to generate heat through shivering when hypothermic. Symptom of hypothermia is shivering and pale skin. Core body temperature is best measured from option A rectum, option B skin, option C mouth, option D armpit. The correct answer is option A rectum. The rectum root reflects the true core temperature most accurately. Core body temperature is best measured from rectum. Normal rectal temperature is approximately option A 30 degrees Celsius, option B 37 degrees Celsius, option C 37.5 degrees Celsius, option D 38 degrees Celsius. The correct answer is option C 37 degree Celsius. Rectal temperature is about 0.5 degrees Celsius higher than oral readings. Fever caused by tissue background example trauma is option A infective fever, option B aseptic fever, option C relapsing fever, option D intermittent fever. The correct answer is option A aseptic fever. Non-infectious causes such as tissue necrosis or surgery can cause aseptic fever. Fever caused by tissue breakdown is called aseptic fever. Temperature regulation is an example of option A positive feedback, option B negative feedback, option C neutral feedback, option D reflection action. The correct answer is option B negative feedback. The hypothalamus maintains homeostasis by opposing deviations in body temperature. Temperature regulation is an example of negative feedback. Heat is primarily lost from the body by option A conduction, option B convection, option C radiation, option D evaporation. The correct answer is option C radiation. At rest, about 60% of heat loss occurs through radiation. Heat is primarily lost from the body by option C radiation. 60% of heat loss occurs to radiation. Which of the following can cause hypothermia? Option A heat stroke, option B thyroid crisis, option C drug reactions, option D all of the above. The correct answer is option D all of the above. Hypothermia can result from multiple non-infectious conditions that increase heat production. Heat stroke, thyroid crisis, drug reactions causes hypothermia. Which condition cause triggers? Option A hypothermia, option B fever with chills, option C heat exhaustion, option D normal temperature. The correct answer is option B fever with chills. Trigger or intense shivering episodes during the rising phase of fever. Triggers are intense shivering episodes during rising. The most common cause of fever in hospitalized patient is option A malaria, option B infection, option C cancer, option D autoimmune disease. The correct answer is option B infection. Infection are the most frequent cause of elevated body temperature in hospital settings. Most common cause of fever in hospitalized patient is infection. Which organ is mainly responsible for regulating body temperature? Option A heart, option B brain, option C hypothalamus, option D kidneys. The correct answer is option C hypothalamus. The hypothalamus acts as the body's thermostat maintaining internal temperature balance. Hypothalamus responsible for regulating body temperature. In fever, heat is produced mainly by option A liver, option B skin, option C muscles, option D blood vessels. The correct answer is option C muscles. Shivering and muscle metabolism increase heat production during fever. In fever, heat is produced mainly by option C muscles. Heat loss occurs mainly through option A sweat glands, option B skin, option C lungs, option D kidneys. The correct answer is option B kidneys. About 80% of the heat is lost through skin by radiation, convection and evaporation. Heat loss occurs mainly through option B, skin. Which of the following indicates heat exhaustion? Option A, cold and clammy skin. Option B, no sweating. Option C, unconscious. Option D, core temperature above 41 degrees Celsius. The correct answer is option A, cold, clammy skin. In heat exhaustion, the body sweats excessively, leading to cold, moist skin and weakness. Which of the a patient with 34 degrees Celsius body temperature is suffering from? Option A, mild hypothermia. Option B, moderate hypothermia. Option C, severe hypothermia. Option D, normal temperature. The correct answer is option A, mild hypothermia. Mild hypothermia ranges between 32 to 35 degrees Celsius. A patient with 34 degree Celsius body temperature is suffering from hypothermia. Heat stroke differs from heat exhaustion because option A, there is a profuse sweating. Option B, there is no sweating. Option C, it occurs in cold weather. Option D, it is not life threatening. The correct answer is option B, there is no sweating. In heat stroke, thermoregulation fails and heat and sweating stops, leading to dangerously high core temperature. The normal range of body temperature in Fahrenheit is option A, 96 to 99 degree Fahrenheit. Option B, 97 to 99.5 degree Fahrenheit. Option C, 98 to 100 degree Fahrenheit. Option D, 99 to 102 degree Fahrenheit. The correct answer is option B, 97 to 99.5 degree Fahrenheit. Normal body temperature fluctuates slightly around 98.6 degree Fahrenheit. When measuring rectal temperature, the thermometer is inserted about option A, 1 centimeter. Option B, 2 centimeter. Option C, 3 to 4 centimeter. Option D, 5 centimeter. The correct answer is option C, 3 to 4 centimeter. This depth ensures accurate core temperature reading without mucosal injury. Heat production in the body is mainly due to option A, metabolic reactions. Option B, circulation. Option C, respiration. Option D, digestion. The correct answer is option A, metabolic reactions. Metabolic processes, especially in muscle and liver, generate body heat. Pyrogens cause fever by option A, lowering hypothalamic set point. Option B, raising hypothalamic set point. Option C, blocking sweat glands. Option D, causing vasodilation. The correct answer is option B, raising hypothalamic set point. Pyrogens stimulate prostaglandin E2 in the hypothalamus, setting the temperature higher. Pyrogens stimulate prostaglandin E2 in the hypothalamus, resetting the temperature higher. The crisis phase in fever refers to option A, risk of temperature. Option B, gradual decline of temperature. Option C, sudden drop to normal. Option D, constant temperature. The correct answer is option C, sudden drop to normal. Crisis indicates rapid fall of temperature through profuse sweating and vasodilation. Crisis phase in fever refers to sudden drop to normal. Lysis refers to option A, sudden fall of temperature. Option B, gradual fall of temperature. Option C, persistent fever. Option D, rise of temperature. The correct answer is option B, gradual fall of temperature. Lysis is a slow return of temperature to normal over several days. Lysis refers to gradual fall of temperature. Antipyretic drugs act by option A, increasing heat loss. Option B, lowering hypothalamic set point. Option C, increasing metabolism. Option D, blocking vasoconstriction. The correct answer is option B, lowering hypothalamic set point. Drugs like paracetamol reduce fever by inhibiting prostaglandin synthesis in the hypothalamus. Paracetamol. The most accurate temperature measurement in infant is option A, axillary. Option B, oral. Option C, rectal. Option D, tympanic. The correct answer is option C, rectal. Rectal temperature reflects core heat and is reliable in infant and young children. The most accurate temperature measurement in infant is option C, rectal. Body temperature is lowest during option A, morning. Option B, afternoon. Option C, evening. Option D, midnight. The correct answer is option A, morning, around 4 to 6 a.m. Due to circadian rhythm, temperature is lowest before walking. Body temperature is lowest during morning, around 4 to 6 a.m. Which vitamin deficiency can interfere with the temperature regulation? Option A, vitamin A. Option B, vitamin C. Option C, vitamin B1. Option D, vitamin D. The correct answer is option C, B1. Thiamine is essential for carbohydrate metabolism and heat production. Thiamine is essential for carbohydrate metabolism and heat production. A temperature of 40 degrees Celsius corresponds to Option A 98 degree Fahrenheit. Option B 100 degree Fahrenheit. Option C 102 degree Fahrenheit. Option D 104 degree Fahrenheit. The correct answer is option D 104 degree Fahrenheit. So the formula is 40 into 9 divided by 5 plus 32 is equal to 104 degree Fahrenheit. Subnormal body temperature after fever indicates option A recovery, option B collapse or shock, option C infection, option D normal. The correct answer is option B collapse or shock. Sudden drop in temperature post fever may indicate circulatory collapse. Subnormal body temperature after fever indicates collapse. Temperature in the armpit is known as option A oral, option B axillary, option C core, option D peripheral. The correct answer is option B axillary. Axillary readings are often used when oral or rectal sites are unsuitable. Temperature in the armpit is known as option B axillary. Which of the following is a physical method of reducing fever? Option A paracetamol, option B cold sponging, option C antibiotic, option D antipyretic. The correct answer is option B cold sponging. Sponging with lukewarm or cold water aids heat loss through conduction and evaporation. Physical method of reducing fever is cold sponging. Which patient condition contraindicates oral temperature measurement? Option A diarrhea, option B seizures, option C cough, option D vomiting. The correct answer is option B seizures. Oral thermometers can cause injury if the patient bites during seizure activity. Which patient condition contraindicate oral temperature measurement? The correct answer is option B seizures. The process of maintaining the constant internal temperature is known as option A osmoregulation, option B thermoregulation, option C hemostasis, option D metabolism. The correct answer is option B thermoregulation. It involves balance between heat gain and heat loss mechanism. The process of maintaining constant internal temperature is known as option B thermoregulation. High environmental temperature may cause option A hypothermia, option B hypothermia, option C pyrexia, option D fever. The correct answer is option B hypothermia. External heat exposure rises body temperature without changing hypothalamic set point. High environmental temperature may cause hypothermia. Fever associated with brucellosis is option A stepladder fever, B undulant type, option C continuous type, option D intermittent type. The correct answer is option B undulant type. Brucellosis produces a characteristic undulating fever pattern. Which of the following is not an example of intermittent fever? Option A malaria, option B sepsis, option C typhoid, option D kala-azar. The correct answer is option C typhoid. Typhoid produces stepladder fever, not intermittent fever. Typhoid produces stepladder fever, not intermittent fever. The difference between morning and evening body temperature is about option A 0.1 degrees Celsius, option B 0.5 degrees Celsius, option C 1 degree Celsius, option D 2 degrees Celsius. The correct answer is option B 0.5 degrees Celsius. Circadian variations cause about 0.5 degrees Celsius daily temperature fluctuation. The difference between morning and evening body temperature is 0.5 degrees Celsius. Persistent high fever with rapid pulse and dehydration suggests option A viral infection, option B typhoid fever, option C heat stroke, option D hypothermia. The correct answer is option C heat stroke. In heat stroke, dehydration and pulse acceleration occur due to thermoregularity failure. Normal tympanic temperature is approximately option A 36 degrees Celsius, option B 36.4 degrees Celsius, option C 37 degrees Celsius, option D 37.5 degrees Celsius. The correct answer is option D 37.5 degrees Celsius. Tympanic temperature approximate core heat and is slightly higher than oral. Normal tympanic temperature is approximately when fever rises and falls irregularly. It is called option A relapsing fever, option B septic fever, option C remitted fever, option D irregular. The correct answer is option D regular fever. Irregular fever patterns are typical in septicemia and tuberculosis. Irregular fever rises and falls irregularly. Which condition causes chills without fever? Option A malaria, option B hypoglycemia, option C hypothermia, option D cold exposure. The correct answer is option D cold exposure. In cold exposure, chills occurs as the body attempts to produce heat. Cold exposure causes chills without fever. In heat exhaustion, the pulse is option A slow and weak, option B fast and weak, option C slow and strong, option D normal. The correct answer is option B fast and weak. Fluid loss and vasodilation cause tachycardia with weak pulse. In heat exhaustion, the pulse is fast and weak. The first nursing action for a patient with high fever. Option A give antibiotics. Option B apply ice. Option C check temperature and report. Option D give cold fluids. The correct answer is option C check temperature and report. Accurate assessment guides treatment and helps identify fever type. The first nursing action for a patient with high fever is check temperature. The glass clinical thermometer breaks hazardously because it contains option A alcohol, option B mercury, option C water, option D silver. The correct answer is option B mercury. Mercury is toxic and environmentally hazardous if the thermometer breaks. Mercury is toxic environmentally hazardous if thermometer breaks. Digital thermometers use option A mercury, option B alcohol, option C thermistor sensors, option D water. The correct answer is option C thermistor sensors. They sense temperature change electronically for quick safe reading. Digital thermometers use thermistor sensors. Hypothermia can lead to option A increased heart rate, option B cardiac arrest, option C increased metabolism, option D fever. The correct answer is option B cardiac arrest. Severe cooling depresses cardiac function and may cause arrhythmias or arrest. Hypothermia can lead to option B cardiac arrest. Fever caused by brain injury is termed option A neurogenic fever, option B aseptic fever, option C pyrogenic, option D septic fever. The correct answer is option A neurogenic fever. Damage to hypothalamus disturbs temperature regulation independent of infection. Fever caused by brain injury is termed as neurogenic fever. A rectal temperature thermometer must be disinfected by option A alcohol, option B soap and water, option C Lysol 1%, option D boiling water. The correct answer is option C Lysol 1%. Lysol disinfects without damaging the thermometer. A rectal thermometer must be disinfected by Lysol 1%. Temperature should be checked after option A 2-hour intervals in fever, option B 6-hour intervals, option C once daily, option D every minute. The correct answer is option A 2-hour intervals in fever. Frequent monitoring helps evaluate fever pattern and treatment response. Temperature should be checked after 2-hour intervals in fever. When body temperature rises suddenly and the pulse is rapid, it suggests option A infection, option B heat stroke, option C dehydration, option D all of the above. The correct answer is option D all of the above. All can elevate body temperature and heat rate. Infection, heat stroke, dehydration, elevate body temperature and heart rate. Which thermometer is used for ear measurement? Option A axillary, option B tympanic infrared, option C oral, option D digital. The correct answer is option B tympanic infrared. Infrared thermometers measure eardrum heat emission. Thermometer used for ear measurement. The answer is option B tympanic infrared. Fever with normal pulse rate is called option A relative bradycardia, option C relative tachycardia, option C step ladder fever, option D crisis. The correct answer is option A relative bradycardia. In typhoid fever, pulse does not rise proportionally to temperature. Fever with normal pulse rate is called relative bradycardia. Heat exhaustion is due to option A high humidity and dehydration, option B cold climate, option C infection, option D hormonal imbalances. The correct answer is option A high humidity and dehydration. Excessive sweating without adequate fluid intake leads to heat exhaustion. Heat exhaustion is due to high humidity and dehydration. Which of the following indicates severe hypothermia? Option A 32 degrees Celsius, option B 30 degrees Celsius, option C 35 degrees Celsius, option D 36 degrees Celsius. The correct answer is option B 30 degrees Celsius. Temperature below 30 degrees Celsius signifies severe hypothermia needing immediate resuscitation. Fever due to drugs is called option A neurogenic fever, option B drug induced fever, option C septic fever, option D septic fever. The correct answer is option B drug induced fever. Some medications, antibiotics, Convulsions can cause fever as an adverse reaction. Fever due to drugs is called drug induced fever. The term normothermia means option A high temperature, option B normal temperature, option C low temperature, option D regular temperature. The correct answer is option B normal temperature. Normothermia refers to maintaining a normal body temperature that is approximately 37 degrees Celsius. Which condition produces hectic fever? Option A pneumonia, option B tuberculosis, option C malaria, option D typhoid. The correct answer is option B tuberculosis. Hectic fever shows wide daily fluctuations with sweating common in TB. Which condition produces hectic fever? The correct answer is option B tuberculosis. The patient's temperature of 38.5 degrees Celsius is termed option A normal, option B mild fever, option C high grade fever, option D hyperparexia. Option B mild fever. Mild fever lies between 37.5 to 38.9 degrees Celsius. The patient temperature of 38.5 degrees Celsius is termed mild fever. Which is the safest method to measure temperature in infant? Option A oral, option B axillary, option C rectal, option D tympanic. The correct answer is option B axillary. It is a non-invasive, safe and avoid mucosal injury. Axillary is the safest method to measure temperature in infants. A patient with heat stroke should be treated by option A warming the body, option B immediate cooling, option C give hot fluids, option D inducing sweating. The correct answer is option B immediate cooling. Rapid cooling through ice packs, fanning or cold IV fluids prevents organ failure. Thank you all.